Second day of the General Assembly, State Senator from Chesterfield, Republican, Steve Martin. Senator, you with us?
Yes, I am with you.
Great to have you, sir. A flurry of activity going on today, all of these bills being filed. I want to start, though, with Terry McAuliffe's speech last night. What did you make of it?
All right. At first it looked like the Virginia CEO was showing up, and I appreciated his comments about the job creation that we've got and and workforce training efforts that we've got together, especially with our veterans and people in reserves and our military. I appreciated all that, but very quickly he turned from being CEO to chief political operative, and it doesn't seem like he has learned the tack that's necessary, or the strategies necessary to unite the majority here towards action. Instead, just seeming to present things for purposes of fighting old battles and trying to just divide for political gain.
Well, I agree with that assessment 100%. I thought, starting off and saying all the wonderful things that he did sound like the CEO of Virginia. That's an interesting comment you made. We're going to tweet that out. But then when he shifted into politics, you almost get the feeling, and this is what I was saying earlier, Senator, I want to get your take on it. He's not really vested in Virginia politics the way Governor McDonnell was, or Governor Kane or Warner. They all knew that their future was in Virginia. His is not. So, his agenda basically is to push national wedge issues, liberal constituent makers, donors out there, because he sees himself as a chief operative of the Hillary Clinton campaign, maybe Secretary of Commerce, maybe he'll run for a president or VP one day. I don't think he's vested in Virginia. What say you?
Well, it's not my job to determine that, but one thing is clear, that that he was kicking off a political campaign last night, and he's trying to position, he's trying to drive wedges, and that sort of thing, and he wants to raise taxes in an enormous way. In one area, it's over 700%. He wants to restrict our Second Amendment right and our ability to purchase firearms. He in fact is taking action which will limit the usage and the markets of coal, which is a vitally important industry to us, and on I could go. I've got bills before my committee that we'll deal with before the month's out that are just fighting old fights just for political benefit. He knows they're not going to happen, and we've got Medicaid expansion again, and on. Old fights just for political gain.
Been there a while. You know what's going on. You've got some things that are percolating along, but for your particular committee, what are your priorities?
Well, one of my priorities is to make sure that our patients and our citizens are safe and being treated well in our healthcare facilities of all kind, whether they be outpatient surgical, inpatient, whether they be hospitals, whether they be doctors' offices, and we make sure that professions are practicing within their scopes of practice. We're dealing with all kinds of bills that touch on those areas. We want to make sure that there's as much competition in the marketplace as possible.
Mm-hmm.
Same thing on the education side. We want competition to flourish. That's how you get the best quality education for the best bang for the buck, and so work in those areas too. And so we'll have a good flow of bills, but those are primary. And I'm going to be doing our tweaking on COPN. I don't know if folks are familiar with that, but Certificate of Public Need. Most any area of practice inside of a hospital has to have state approval before they can do it. From the, even putting in a new bed right now, or any, most any significant piece of medical equipment and practice within your facility has got to have state approval, which is its purpose is to hold down competition, to be honest. And we're going to tweak that. We're not going for an outright repeal right now because the political environment is not good for it. I've tried that on a number of occasions previously, but we will be successful with this effort.
So how would that work? I know you've been.
Let's just do the biggest thing. Let's say a hospital wants to build somewhere.
Right.
It has to come to the health department and file an application for their approval. And the state either approves it or doesn't. And if they do approve it, they put requirements on you as to what kind of money you have to put into the Indigent Care Trust Fund, stuff like that. But they got to do the same thing if you're just adding beds, or if you're, let's say, adding a piece of equipment like an MRI or something like that, or an area of practice, an area of surgeries.
I know in the past you've tried to just repeal that whole thing. Now you're trying to tweak it because, again, the environment's not there.
There's 6 areas of repeal. I would say 6 areas of repeal, if you would, that we're touching on the legislation I have. And the HCA hospitals, Healthcare Corporation of America, is supporting it. Some other hospitals are supporting parts of it. Some are opposed to it. The Hospital Association, I think itself, is opposed to it. I think that the docs are all for it. But they're, in the medical field, they're kind of divided on this because COPN itself kind of helps to hold down competition, and that causes harm financially. That's the way they look at it to existing practices.
We're with Senator Steve Martin, Republican, Chesterfield County conservative. I don't know if I'm sure you've heard about this, but the FBI is probing, I guess, an embezzlement allegation of $600,000 out of Dick Saslaw, the minority leader's campaign Democratic caucus money. And Senator, $600,000, that's a lot of money.
I'm floored. I saw that just yesterday, and I have no earthly idea how $600,000 can flow out of an account over a good period of time, and the managers of that account not know it. That is just amazing to me. And I'm not saying that the gentleman, the Dick Saslaw, knew it, but I certainly would think he should have known it. I'm just floored by that.
That's just a lot of money. That's just $600,000 is a lot of money. And just reading it, I haven't talked with him. He was scheduled to come on tomorrow, and he asked to delay it a week while they try to figure this out. But apparently there was something like 80 or 90 checks written. And
how did that happen?
I don't know how that happened because that's.
I'd say if you have responsibility for accounting, you don't know any more than that. There's something wrong.
Yeah, well, and then they were saying I had heard last night that the FBI might have been on to whoever was behind it, because this is obviously you're just writing checks for something that doesn't exist. $600,000.
They were saying that the checks were going to a particular address or somebody that had some responsibility in the account, but they weren't. Didn't mean that person was responsible for the embezzlement. I think that's what I've read, which again, that was kind of mind-boggling too. But
yeah, well, you just can't keep your eyes off of any of this stuff.
In this session here, I would have thought that the governor would have been better off, John, if he would have been willing to maybe expand his vocabulary a little bit to include a few more pronouns beyond the first person.
Aye.
And focus his agenda on some things that he knew that the majority in the House and the majority in the Senate could work towards. And there are going to be things like workforce training, stuff like that. We're going to be able to work together on. But it would then, the egotism and the desire to just fight that was displayed last night was not healthy for this session before.
Well, as I said earlier, and this is just my narrative, I listened to the speech last night, and he's got a lot of enthusiasm, and I agree with you. I did like the opening because he's kind of like the CEO, and he's going around the world and bringing business in and creating jobs, and that's all a good thing. But once he got to what I think you termed as chief political officer, it really got to a national campaign narrative, a state campaign narrative. It had nothing to do with getting the people's work done, nothing to do with good governance, nothing to do with working together. It was all about how does he win 2 or 3 Senate seats in 2015 in November.
There's a pep rally for Election Day in November of this year.
That's basically
it was an organization towards Election Day.
All right, I've got 1 minute. Very quickly, there's some that are hoping to move to a shorter U.S. 460 project quickly. I know some of that affects the area that you represent. In like 45 seconds, can you sum that up?
Well, I mean, Governor McDonald's effort there was quite ambitious, and no matter which way you cut it, it was going to have a positive impact for our state, but a potential negative impact for particular areas. I do think that needed to be curved back. I do appreciate the need for the east-west corridor, but it's going to have to be done in a more modest manner. And I've got some ideas myself as to how to minimize the negative effect and maximize the positive effect for the communities through which it either passes through or passes by, and still have a great economic impact for our state.
All right. I'll tell you what, we're going to get you on next week and get that flushed out. You want more information, go to SenatorSteveMartin.com. That's SenatorSteveMartin.com. This is